Today we are going to discuss about leukemia, which is a very common topic, and we do have a lot of patients and a lot of clarifications actually needed from patients' perspective. We are going to discuss on leukemia. Whenever people hear about the cancer, first thing they think about blood cancer, and as soon as they think about blood cancer, suddenly some fear complex come to their mind. So blood cancer meaning that blood cells are proliferating very rapidly. So one cell proliferate rapidly than others. So taking one step back, blood is produced in the bone marrows, and bone marrow produces all the three cell lines: red cells, white cells, and platelets. All these three cell lines, they have their different functions. For example, red cells, they carry oxygen, and we need oxygen for our day-to-day living. White cells, they fight the infection, and platelets, they basically form a clot when there's a bleeding. So bone marrow produces these cells. Sometimes in a cancer situation, what happens? One of the cell lines they proliferate rapidly rather. When they proliferate rapidly, they don't allow the normal cells to grow. So they take the majority, like they become the majority and they take all the space. So then when the leukemia cells proliferate, and then they don't allow the normal cells to proliferate, hence patient becomes anemic because the hemoglobin goes down, platelet count goes down, then they develop bleeding symptoms. That is what we understand when we talk about leukemia. So rapid proliferation of those cancer cells of one segment. And there are so many types, as we discussed, to simplify again, there are acute leukemias and chronic leukemias. When we talk about acute leukemias, there are two acute leukemias: acute lymphoblastic leukemia, then acute myeloblastic leukemia or myeloid leukemia. Similar to the chronic leukemia, there are two types: chronic myeloid leukemia and chronic lymphocytic leukemia. So chronic leukemia is actually a different group because the treatment is very specific and the patients, they live longer. Acute leukemia, the one people get worried about and we really get frightened about, that is acute leukemias, both acute lymphoblastic leukemia and acute myeloid leukemia. Mostly when we talk about blood cancer, we talk about acute leukemias, but we also need to know a little bit about lymphoma and myeloma. So these are also a type of blood cancers, but they are different. Different in the sense that lymphoid malignancies called lymphomas, and they originate from the lymphoid tissue, like your lymph glands in the neck or armpits or groin area. So this starts in the lymph glands, but they also travel to bone marrow and the blood. So ultimately, it's a generalized systemic disease, but starts in the lymph glands. Similar myeloma, it starts in the bone marrow, but affects the bones and affects many other organs. But people sometimes get confused when you talk about myeloma; they also think it's a blood cancer, but they're slightly different. Acute leukemias, usually there are factors which can affect, and some patients have slightly higher risk. And it can affect any age group. There is no age bar, particularly if somebody, advanced age, after 60, generally it is slightly more common because bone marrow goes through a aging process. Normally, we don't see, those cancers developing in everyone. But if there are some additional risk factors, like somebody is working in some high-risk environment, or they have got work hazards, for example, they work in the lead factories or some of those industries where there is a exposure to nuclear material, or they were exposed to previous chemotherapy or radiotherapy, they had to go through previous chemotherapy, they're also high risk of developing these cancers. But so we also have noticed that people, they handle pesticides and they handle chemical in some of the chemical industries, they have slightly high risk. So we need to be really careful about the exposure of to those materials and how we can prevent those. Symptoms, it could be very simple symptom like patient is lethargic, lack of energy, tiredness, they get fatigued very easily. That could be the early sign. And if the patient has infection, for example, they have a throat infection or some lymph node enlargement, probably initially thought that it was due to infection, patient has one course of antibiotics. It subsides, then recurs again. So if it goes on for some time, patient is requiring multiple courses of antibiotics, then that should bring the suspicion. Then the bleeding symptoms. Patient may have minor bruising, like, due to injury or without injury, they may have bruises, which is unusual for the patient. They may develop bleeding through the nose called epistaxis. They may have bleeding while coughing, or by passing blood in the bowel motions or the urination. So those would be some of the symptoms. And in females, they may have increased periods, which could be unusual. If it is unusual symptom, either bleeding or infection, or they have AG fatigability, or which is going on for some time, then that should bring the suspicion. In young children, there could be some minor symptoms like arthritis-like symptoms. Normally, children should not have arthritis. If that is there, that should bring the suspicion. And as a normal standard, if a child presents with arthritic-like symptoms, we do screen for leukemia. So that is very important. And if somebody has any of the symptoms, they should see the doctor and do the consultation and then do the subsequent testing. And the earlier they go to the doctor to see take their consultation, that would be very useful. So the other symptoms also equally important when the patient loses weight. So more than 10% of the body, well, like let's say somebody is weighing 50 kilos, if they suddenly lost 5 kilos out of nothing, not trying to lose weight, but still lost a lot of weight. Loss of appetite is very important. And the loss of appetite without any factor, and also developing night sweats. So the patient normally we don't sweat that much, but if it is to that extent the patient is sweating that much and has to change the clothing, then very important. So all these and also patient looking emaciated, like as if there is no energy, and so those are the suspicion one should bring and should definitely do the blood test after that. To diagnose leukemia, the first thing is obviously the symptoms and suspicion. Next thing is a blood test, and very basic blood test, which is called CBC. So when the CBC is done, all the parameters of the blood is looked at for hemoglobin, white cells, and platelets, and every component of the white cells. So how many neutrophils are there, lymphocytes, and rest of the white cells. That is important. Then subsequently, the pathologist will ask for a blood film examination. What happens with the blood film examination? The pathologist will look under the microscope, look out for those abnormal cells called blasts or leukemic cells. And any abnormal cells, there could be a situation where there would be persistence of some bone marrow changes, which can be reflected in the blood. Then you look at other leukemic cells. So that is second step. Then you look for your coagulation factor. So there could be bleeding, and then your coagulation factor could be deranged. That's also important thing to look at. Then you look at the liver functions, kidneys, and all those, but that is secondary. Next important test would be bone marrow. Once there is a suspicion for the leukemia, definitely person should have a bone marrow biopsy, bone marrow aspiration. And these are the specialized tests, so hence it would be done in a specialized center. But the basic test can be done in even the district hospitals and smaller centers, they can do it. Then when the bone marrow is done, what happens, you look at the morphology of the cells and everything. Also, that gives the opportunity to look at the cells a bit more closely, what is called flow cytometry. There are very advanced tests, but this will give the idea about a type of the leukemia, and then your genetics of the leukemia. So that's very important. These days, we need to understand what are the genetic marker of those leukemias, and that will help us decide and plan the therapy. And also we can give some prognostic idea, like how the patient is going to do long term. So those ideas we'll get from the genetic studies on the bone marrow. Then you have other tests, like you have to do the CT scan, you have to do the ultrasound, just to add more value so that we know what is happening in the lungs, what is happening in the kidney. So those also information we need to know at that point. For chronic myeloid leukemia, there is only tablet option. There are 3 or 4 different tablets options are there, and the patient need to take those tablets for long term. Then 90% of the chance that the patient can be cured. So, but they have to continue the treatment. Then similar chronic lymphocytic leukemia, there are a lot of treatment has been developed over the last few years. So the patient can be also to some extent, even though it can't be cured, but also we can simply continue the treatment, and the patient can be near cure state for a long period of time. But after discussing those chronic leukemia, so next is acute leukemia, acute myeloid leukemia, and acute lymphoblastic leukemia. The main key point here, actually, the treatment has to be continued without stopping. The patient should not stop the treatment in the middle. Particularly for the acute lymphoblastic leukemia, treatment will go for long period of time, for 1.5 years. So there will be a lot of maintenance therapy, which should be continued. If the patient stops the treatment, then you can't achieve that cure. In children, when we have a patient with acute lymphoblastic leukemia, the cure rate could be up to 90%, even more than 90%. Acute myeloid leukemia, the treatment is not that long, only 4 months, but the patient has to strictly follow the treatment guideline. And generally, the patients actually they get the treatment in the hospital setting. The patient has to be hospitalized for the entire period, almost 3 to 4 months, I would say. And then they continue the therapy and they are closely monitored. The main key point here is a supportive mechanism. We should have a good nursing system and the patient should be well cared for. And also during that time, patient should be closely monitored for any eventual complications. If the complications arise, they should be managed pretty promptly. So in nutshell, the treatment goes for acute myeloid leukemia for 4 months, and acute lymphoblastic leukemia goes even longer, 1.5 years. But key is that you have to continue the therapy, better manage those patients during the chemotherapy and after finishing the chemotherapy with a lot of supporting system. They should eat more protein containing diet. And then the other thing is whatever is home cooked is better, because outside food probably can cause some infection related problem. So home cooked. Uncooked food is generally avoided. If you want to take salads, that's absolutely fine, but that should be freshly prepared at home. That is advisable. Raw meat, raw fish, again, like for example, sushis, anything that is raw should be avoided, and anything that is properly cooked should be preferred. When we talk about long-term management of acute leukemia, first thing, let's say the patient has completed therapy and has achieved the cure. I won't use that word cure, but I think achieve the remission. Then we have to monitor those patients for a long period of time. There could be some complications that can happen, such as further infection, because the immune system will be low. They will have more infection down the track. Organ dysfunction can happen subsequently. Those need to be also monitored properly. And the patient may develop second cancers. It's very unfortunate the patient has gone through the chemotherapy for one set of diagnosis, but down the track there can be second cancer, which is very unfortunate, but does happen. But that can happen even beyond 10 years. So those things very clearly needs to be monitored and managed quickly.